Today, we're going to talk about rehab and you being your best advocate while the doctors and physical therapists are telling you things they want to do. Because sometimes you need to make sure that they're doing the best thing for you. And with that, you want to ask them questions. If you have a friend that's a doctor, you can call them to say, hey, what do you think about this? Is this right? And get another opinion. And then that way you're cover all your bases. Your doctor is not going to tell you what they believe your recovery is going to be initially. They're going to wait and see how you respond, and in the hospital it'll be very minimal. Then you'll go to rehab, and then they still really won't tell you what they believe your recovery will be or prognosis because they don't know. And I'm going to teach you with perseverance that you can overcome just about everything. Initially, the doctors are going to tell you that, generally speaking, you'll get 70% back in the first month, and you'll get back what you're going to get back in 90 days. That is not true. If you've had a severe stroke like mine, I'm coming up on 2 years, and I still can't operate my left hand and my left arm correctly, and I'm still having trouble walking. However, I'm constantly making progress. So never give up because we're warriors and we're here to be successful and win this fight. Okay, with perseverance, once I was doing research in the hospital bed, I learned that there was a gentleman that had a stroke 20 years ago and his left hand did not work well. And he said, you know what? I'm going to work on it and get it better 20 years after the stroke. His family told him he was wasting his time. He spent quite a while working on his hand. I don't know exactly the time period. However, he was able to get his hand much better. So never give up. Don't listen to the doctors when they tell you this is all you're going to get. Because if I'd listened to the doctors, I should be dead. One thing you will notice after the stroke, the medical community says you will be very impulsive. Now, I was ADHD, so that was normal for me. However, you need to throttle back and evaluate the risk of what you're attempting to do, because that's how a lot of stroke patients injure themselves before they get to rehab while they're still in the hospital. So be patient, work with your family, tell them what you need, tell them when not to pull on your arm or leg because you cannot contract the muscles. That will avoid a lot of injuries. Another important thing is to be your own advocate in the hospital. Unfortunately, our medical system is overworked and mistakes happen. And what happened to me was they forgot to put the SCDs on my legs because I'm inactive, so I didn't generate a blood clot even though I had a brain bleed. And 5 days after my brain bleed, I ended up with a 8 to 9 inch blood clot in my left leg behind my knee to the middle of my calf. And I initially told my wife, I said, hey, my left calf is cramping really bad. Can you massage it for me? And then when the nurse came in, I said, hey, can I get those calf squeezers? They're called sequential compression devices. You want to make sure they put those on day one because that will help you not get a blood clot if you had a brain bleed, or they should put them on if you had a blood clot. But just in case, if you had a brain bleed, they may forget. It is so important to be your own advocate because once I had my blood clot and my brain bleed had stabilized, the doctor came in and told me they wanted to give me blood thinners. Well, fortunately, I had a couple of friends who were doctors and I called them. I said, this is crazy. They want to give me a blood thinner and I just had a brain bleed. And my friend who's a doctor said, don't let them give you blood thinners. That will kill you. I said, okay. Tell them you want an IVC filter. So if the blood clot does break loose, the IVC filter will catch it and you'll be okay. I was told that you shouldn't take blood thinners after a brain bleed for at least 2 weeks so the brain has time to heal so it doesn't cause that portion of the brain to rebleed. I really got a great catch-22 because, as you know, I had a brain bleed and then I had a blood clot because they forgot to put the SCDs on my leg. But my dilemma continued because when they put the IVC filter in, they put a nickel titanium IVC filter in. I didn't know this at the time, but they do make plastic ones. So my problem was I couldn't get an MRI for my brain until my IVC filter got out, and I couldn't get the IVC filter out until we got rid of the blood clot. So as you can see, I was in this dog chasing its tail, and I had no way out because until I got the blood clot under control, could we take the IVC filter out? So really be an advocate for yourself, and it will pay dividends. Always think through what they're going to do, and hopefully you have someone you can talk to bounce ideas off of them, or ask the doctor. Question them. Say, hey, would you do this? Or is this safe? And see what they say. Another important thing to remember about IVC filter, and I don't know why people forget, but you need to get them out within 6 months. There are so many patients that had an IVC filter put in and never had it taken out. And the problem is, if it stays in very long, the body starts to grow around it and you cannot get it out. So make sure if you do get an IVC filter, get it out. One thing that I always remembered was you only get one ride on the merry-go-round, so make it count, okay? And as you recover from your stroke and you're doing better, I have noticed by coaching other stroke patients that when they stop doing their exercise or living their life, for whatever reason, their body decays rapidly. And then some other ailment takes over and they pass. So this is a lifelong fight, and we're going to live our best life. Thank you for watching this episode. I hope you like and subscribe. And in the next episode, we're going to go over going to the rehab hospital and what to expect there, and how to accelerate your progress there.